So there are three main treatments for cancer: surgery, radiation and drugs. And drugs are of three different types. There's chemotherapy, which all of us have heard of. There's something called hormone therapy, or really anti-hormonal therapy. And the third one is targeted or special drugs. The main treatment out of these is actually surgery. For most solid tumors, surgical removal removes the bulk of the disease out of the body and is and can cure people who have very early disease. Surgery of the breast is of two types. One is called a mastectomy, where we actually remove the whole breast. The other is called breast conserving treatment, where we try our best to conserve the breast. What determines this type of surgery is the size of the tumor. So if the tumor is small, you can remove the tumor with a margin of normal tissue, and that allows you to preserve the breast. The only thing to remember is when the breast is preserved, the radiation therapy, which is the second form of treatment, has to be given along with removal of the lump. If the whole breast is removed for a small lump, then radiation can be avoided in the vast majority. Who requires drug treatment or chemotherapy? Well, anyone who has a tumor which is larger than 1 centimeter in size will require some sort of drug therapy. And why is that? Because it's very simple to understand. Surgery and radiation is used in a combination to control the disease at the site where it starts, that's the breast, while the drugs are used to control the disease in the rest of the body. So we use a combination of local treatment, that is surgery and radiation, as well as drugs to control the disease in the whole body. And why is that? Because we know that cancer starts in one place and tends to spread. So we have to cover or control the disease at the site where it starts, as well as in the rest of the body. Who requires chemotherapy? Chemotherapy is a dreadful word because people lose their hair and lose their eyebrows. So most people are really worried about their appearance. Chemotherapy, luckily today, things have changed and is not necessary for everyone. Olden days, most people were offered chemotherapy, especially in the last 20-25 years. But today we know that there are certain new tests called genomic tests which have come up, and we can even look at the type of DNA within these cancer cells and see which are the genes which are being expressed and get a pattern, or what we call a genomic profile of the tumor, to tell us which young people or breast cancer patients can actually avoid chemotherapy. So chemotherapy is today not necessary for everyone. But there are also a lot of misconceptions about chemotherapy. So although chemotherapy does make you lose your hair and your eyebrows, today we have wonderful wigs which are available, and people can make the best of what is a relatively bad situation. But one must also remember that the hair comes back, and comes back as thick as it was before and in the same color as it was before. So it's a temporary situation which can last as much as 6 to 8 months, which is followed by normal hair growth.